and welcome. On behalf of Royal Inland Hospital Foundation and Interior Health, I would like to recognize and acknowledge the traditional unceded territory of the Inuit Nation, where we live, learn, collaborate, and work together. I'm glad you had the opportunity to tune in perhaps a little earlier and hear my CD of Christmas music I recorded about a year ago. It's available on Spotify, Amazon, or wherever you buy your Christmas music. So please pick that up as quickly as you can. Great Christmas gift. I want to thank you for taking time out of your busy schedules. I'm hoping that a year from now we won't be needing things like this, but who knows? We certainly hope so. I know it's been a very trying year. Again, I want to thank you for taking your time out of your busy schedules to be with us here tonight to hear from the hospital's Chief of Staff, Dr. Todd Ring. For those of you who don't know me, my name is Jim Reynolds. I'm an ex-broadcaster. I'm now retired, formerly with NL Broadcasting. I have also spent some time in the past with the Royal Inland Hospital Foundation Board, and about a year and a half ago was approached to chair the Tower Campaign Committee. And that Tower project you're going to hear more about, an update from Dr. Ring here in just a few minutes. Although I'm sure you'd like to spend half an hour or so more with me, I think we'll probably pass on that. Our goal, $25 million. I'll come back to that in just a moment. And you're going to learn more about how that $25 million is going to be allocated with Todd in just a bit. And that goal is over the next 4 years. So it's certainly very tough to reach. Well, maybe. I was approached about this role to chair this campaign committee about a year and a half ago. For me, it was a no-brainer. I'm a long-time Kamloops resident. I believe in our healthcare. I believe that Royal Inland Hospital has to be the very best it can be. And I believe that we have to have some blood in the game. And to do that, we need to have the community come together. I mentioned that goal of $25 million. It's certainly a very tough one to achieve, but I'm here to tell you this. I don't believe we're going to reach that goal. I believe we're going to smash it. And I believe we're going to smash it because of the incredible support we've seen from the community so far, and we haven't even started the public campaign. I know it's going to be very successful, and it's going to be successful because it's necessary. It's what we need. And perhaps in this time of COVID, we've never really understood that more than we understand it today. The current expansion of our hospital is of paramount importance. So I hope you enjoy what you're about to hear tonight. I'd like to now introduce the CEO of our foundation, Heidi Coleman, for a few words. Heidi?
Thank you, Jim. Yeah, I'd like to echo Jim and thank you all for joining us here tonight. So I really appreciate you taking your time to listen to Dr. Ring and what he has to say about how this new tower is going to change patient care in Kamloops. But before I introduce him, I just want to acknowledge two donors. You might have heard about this today in the news. Frank and Almarina Rizzardo of Merritt, BC. The Rizzardos are wonderful people, and they've donated $200,000 to the patient care tower over the past 2 years. And it's for critical needs at the current hospital and in the tower. They're wonderful donors to many hospitals and charities around BC, and we greatly appreciate their support. So we're pleased to have RIH's Chief of Staff, Dr. Todd Ring, here with us tonight to provide all of you with an update on the current expansion at our hospital and the future of healthcare in Kamloops. Originally from the Kamloops region, Todd has been an emergency physician since 2005. He is a former department head and former medical director of Interior Health's Emergency Network, Transportation Service, and Access and Care Transitions. He's played an important role in shaping provincial approaches to rural emergency and transportation service delivery through his membership on the Provincial Emergency Service Advisory and BC Patient Transport Network Advisory Committees. Outside of work, Todd is married to Leslie, an emergency department nurse at RIH, and they have 3 children together. Todd serves as team doctor for the Kamloops Blazers major junior hockey team and is a traveling physician for Alpine Canada ski teams. Without further ado, Dr. Todd Ring.
Great, thanks very much, Heidi and Jim. It's always a real pleasure for me to participate in any of our foundation events, and I'm really happy to be here tonight to speak to you all. And before I start, I actually just want to extend a tremendous thank you to everybody who is on the call this evening. It is really the people of Kamloops that make our community what it is. And again, it's the support of our hospital and the foundation that you all give that is what makes our hospital what it is. Before we start, Heidi did ask me to give a quick update on the current COVID situation, and I'm happy to provide that. I'm happy to keep speaking, and the slide deck's up. But I am happy to provide a quick COVID update for everyone, and then we'll get into the real heart of the presentation, which is around the Patient Care Tower project, which I'm really excited about and have some exciting news to share as I went through the building for the first time yesterday. So the current COVID situation in Kamloops is it is continuing to evolve, as we all know. And fortunately, I think as many people do know, we've done fairly well within the Thompson-Caribou-Shuswap region, in particular in Kamloops. And I really do want to extend a huge thank you to all of our citizens who have been following the guidelines and the recommendations of Dr. Bonnie Henry. Having said that, we do anticipate that there will be ongoing pressures that we experience within Interior Health and in Kamloops over the next couple of months while we await the ongoing good news about the COVID vaccination, and I'll speak about that in just a second. We have, through the first phase, really been able to get a lot of our processes in place that will allow us to manage and have the capacity in our system to experience the second wave. And that really speaks to a lot of the efforts that have been going on both within Interior Health and across the site with regards to our occupancy in the hospital and our critical care occupancies. And so we are definitely seeing COVID in the community. We are definitely anticipating a surge of patients coming to the hospital, and we have worked hard to develop all of our policies and protocols to allow us to safely do that. And fortunately, we're in a much better position to stand the second wave, in particular with the supply of our personal protective equipment that has really been solidified, as well as all of the procedures. The other piece that I think is important is that we did need to cancel elective surgeries during the first phase. And fortunately, we've done very well on the catch-up, and it's anticipated that in the early part of the new year and into the spring, that we should have caught up with all of the canceled surgeries that happened. And the other part of that is that we're actually looking at ways to continue to expand our surgical services, not only within Interior Health, but more specifically within the Kamloops region. And then a quick comment just around the COVID vaccine. I was just on a medical leadership call earlier today, and we fully expect Interior Health to be receiving our first doses of the vaccine in the next couple of weeks, even before year's end, and can start the process of vaccinations and just working through the sequence of vaccinations and who will be those individuals prioritized to get vaccinations. And as many people have been hearing, consistent with the message coming both federally and provincially, our healthcare workers in long-term care, our long-term care clients, and our frontline clinicians will be among the first of those people vaccinated, and then the general community following that. So with that, I'm happy to transition the talk into the Royal London Hospital Patient Care Tower. And it is actually really fitting in the COVID times to be speaking about this. And as I did mention, I had the very pleasure of going through the Patient Care Tower for the first time yesterday and seeing the significant progress that's been made. And I think the consistent comment that was made by myself and Tracy Ranney, who's our executive director that was on the tour, and Megan Hansen, our health services director, who's overseeing this, was, wow, it is really impressive. And the second comment that both Tracy and I looked at each other as we went into the lobby and the new entrance to the hospital, it's like we were like, wow, we're actually going to have a real hospital. And of course, we already have a real hospital, but it's going to feel like we've got a front entrance to the hospital that is grand. It's going to bring people here. It's going to set the stage with the appearance and the look of the hospital. And it's going to be really exciting. And then as we moved up through the hospital floors, which I'll speak about, they're all equally impressive. And I guess my last thing I want to say just in opening is that I really do feel a tremendous sense of gratitude that I get to speak to you about the project. And one of the main reasons that I do the work that I do and that I love doing the foundation events is that it really allows me to speak about one of the areas which is service delivery and how we can enhance patient care and services is what motivates me to do my administrative work that I do. So the Royal London Hospital Patient Care Tower will transform health care for our community. I am absolutely confident of this. And in the presentation tonight, I'm going to walk you through why I believe that is the case. So we can advance to the next slide. If we go back about 100 years or so, and that takes us to 1911, Level 3 is really going to be our mat child areas. And this includes a new labor and delivery, postpartum area, as well as our neonatal intensive care unit. Level 4 is going to become one of the most exciting parts of the hospital and one of the most needed parts, which is our brand new surgical suites. And so level 4 will connect back with our existing level 4, as will levels 2 and 3. But level 4 currently in our old building is our operating theaters. And what we're working on is with level 4 in the patient care tower are 13 brand new operating suites. And these suites are massive. They are beautiful and they have a central core that allows for the delivery of all of our equipment to be in a sterile environment. And it's really going to enhance our surgical services. When the patient care tower opens, 11 of the rooms will be operational. The 2 of the operating rooms will be an interim recovery area. And then with the second phase of renovations that I'll speak about with patient care tower, we will be redoing our post-operative recovery area, which will allow us to open 2 additional operating theaters that are both what are called hybrid suites. And I'll speak about those shortly. Level 5 is support spaces for our surgical personnel, change rooms, outpatient patio, and then a large footprint of mechanical on that floor. Level 6 is our inpatient mental health and substance use unit. So if many of you have heard of people or have had family members that have been in our existing mental health area, it is really outdated. And this is going to be another major improvement for our facility. And again, speaks to the need to be able to provide the services for that population. Level 7 is an inpatient unit focusing on rehabilitation and geriatric psychiatry, allowing some really neat and innovative ways to treat our elderly patients, in particular those that have risks for delirium or dementia, safeguards on the unit to prevent wandering, lots of natural light, again, that improves patient outcomes. Level 8 is an inpatient unit as well, focusing on our neurosciences, a stroke unit, and a new trauma unit that is really exciting for us. Again, a lot of these focus on some of the areas of strength of our institution already, but having these services in a dedicated space will certainly enhance our patient care. Level 9 is the mechanical penthouse, and then level 10 is our rooftop helipad, where our BC ambulance helicopter can land. The patient goes directly into an elevator down to the operating theater, to our intensive care unit, or to our emergency department. Next slide. So that's all in phase 1. Phase 2, after the patient care tower opens in the summer of 22, phase 2 then is over the next couple of years, which is 2 years of renovations to our existing spaces. Our emergency department will have a significant expansion, more than doubling in size, including a new mental health area within the ED, which is a significant piece. There's going to be lots of updates, and certainly in these COVID times, and all that we've learned about the need for isolation, the new department is going to have isolated care spaces. We are also having a new recovery area that I spoke about that will be on the 4th floor in the old building that directly connects into the operating theaters on the 4th floor of the patient care tower. We have renovations to our morgue, some minor lab renovations, and a new pediatric unit that's going on the existing 3rd floor that is in direct proximity to the neonatal intensive care unit that will be in the new building. And within our pediatric unit, we have a brand new Ronald McDonald house/family room to support patients that have children in the NICU or on the pediatrics ward, such that they can be closer to their loved one that's in the hospital. So there are some key features that I also want to highlight within the patient care tower. On the next slide, you'll see one really exciting piece, and I got to see this yesterday on the tour, which is our new atrium. This is a massive space, lots of natural light. This was an existing courtyard that was kind of between the two buildings, the old building as well as the new patient care tower. It's adjacent to our cafeteria. And I think this is going to be a great multi-use space that I can foresee lots of exciting events in there. It's a great space for both patients and families, as well as our staff to decompress in. And I think we will really capitalize and use this space. And kudos to the Ellis Don design and construction team for bringing this forward in the design. Another key feature is new private patient single patient rooms. And so we know there are many benefits of having our patients in single rooms. In our existing building, only approximately 20% of our rooms are single patient. And once the entire project is completed, almost 80% of our rooms will be single private patient rooms. And this is really important to not only provide better patient family-centered care. You can see at the back that room at the back is a private washroom for the individual patients. This will also help with lots of infection prevention and control measures. And if you can imagine in these times in which we're in a pandemic, someone having their own room where they can have their own washroom, that is absolutely key to minimizing any types of hospital-acquired or transmitted infections. Our next slide is really around the patient care tower, as I said, is really going to allow us to transform patient care in so many areas. And really what it allows us to do is continue to build on lots of those areas of strength of our hospital. Looking at our neurosciences program for neurology, neurosurgery, and mental health, trauma, as well as maternal child. And it's absolutely imperative around recruitment. Physicians and all clinical staff, whether it's nursing, allied health, etc., are drawn to work in a state-of-the-art facility. And I really do think that this is going to continue to help in our recruitment efforts. I can certainly tell you that I meet with and interview almost all of our new recruits, and I highlight patient care tower on a regular basis because I know the draw that this is from a recruitment perspective. I have touched on the operating theaters already, and I just want to come back and highlight this again. If you're wondering what that red line on the floor is, and doesn't probably do it as good enough justice as it is, the red line is actually the size of our existing operating theaters. And that amount of equipment that you're seeing there is pretty standard for most operating theaters. The new rooms are substantially larger, and in fact, some of the largest in the country when all is said and done. And this really allows us to achieve much better surgical outcomes. You can imagine if you can get rid of the clutter, you have proper airflow, you have the appropriate technology, then it only will enhance patient care. And so, as I mentioned, when the tower opens, there'll be 11 brand new operating theaters that are the standard size. And then once we finish the phase 2 renovations and the recovery area moves out of the 2 hybrid ORs, they will then become 2 additional theaters. A hybrid OR allows us to use even further advanced technology during the operation to be able to do extensive procedures with regards to vascular surgery and stenting, with regards to neurosurgery and neural mapping, and a number of procedures using robotics and advanced technologies. And so again, from a recruitment retention perspective, this allows us to continue to develop our surgical programs and continue to bring higher levels of expertise to the site. I've spoken about mental health a couple of times, both with our child and adolescent mental health and our adult mental health. And these pictures are really meant to depict what we need to do to transform the treatment of mental health to a much more patient and family-centered approach, which will allow us to achieve better outcomes. On the mental health, on both mental health units, both on the inpatient pediatric as well as the inpatient adult mental health units, there's an outdoor patio that's a secure patio, obviously meeting all of the standards that are required for this patient population. There's also larger gathering areas that have access to natural light, allow for socialization activities as well as community therapy and group therapy activities in a much more patient and family-centered capacity. So again, we're really excited about the changes and the upgrades to our mental health ability at the center. What would be a talk at RAH without talking about parking? And I say that we seem to always like to be in the news, and at some point in time we would love to be out of the news for parking. The new patient care tower project does have a significant expansion of parking stalls. As I mentioned, there's approximately 50 stalls, I think, below the patient care tower, and then there's another 150 stalls, I believe, in that area above the St. Anne's Academy in the Westlands parking. And so again, this will be a combination of staff and visitor parking. Exactly how that's distributed, we'll look at that. But again, this is very key to the provision of services here. We know that we service a large population from our rural communities that requires them to drive here, and we do understand the need for people that have access to parking, and that's for both of our patients and our staff. And so we're looking forward to further addressing all of our parking needs through the project itself. Just want to talk about one other exciting initiative that's linked to the patient care tower project, and this is actually a massive undertaking in and of itself. So in addition to all of the regular program activities that we have at the site, as well as the patient care tower project, we also are the first site in Interior Health to go live with an electronic platform for all of our clinical inpatient areas. And I really think that this is going to continue to enhance and promote excellent patient care. Our emergency department actually already is on an electronic medical record, and that's the environment that I work in. And this includes both the documentation piece for our clinical staff as well as an ordering component for the clinical staff. And then what this allows us to do is start to leverage technology to allow us to make better decisions in healthcare. It brings up flags from a patient safety perspective, so that if someone has an allergy and I try to order a medication, the system flags me that that is contraindicated or that there's a drug interaction, or if someone comes in and they're having a heart attack or a stroke, it can prompt me to follow the right clinical care pathway and guide that down, including access to any literature or best evidence that I might need, as well as a direct link into order sets such that patients get access to all of that. It's a lot of work converting from a paper environment into an electronic environment, but it really is paving the way for that. And so we are really looking forward to this project. The ACE project, Advancing Care Electronically, is set to go live in the summer of 2021, so 1 year in advance of moving into the patient care tower. But we knew it was absolutely linked to the patient care tower in as much as we needed to design the patient care tower appropriately so that we can accommodate the different workflows in the computer environment in the patient care tower. Next slide. So those are the formal part of the presentation tonight. I just want to close again by thanking you all and acknowledging the contributions that everyone has made. I often speak of the thing that sets Kamloops apart and RH apart is our medical staff. And our medical staff is truly remarkable, as all of our clinical staff are. And I do think that is a reflection not only of the hospital, but of our larger community. And again, I really want to acknowledge the contributions of all our donors that allow us as physicians to provide the care that we are able to provide.
Thank you, Todd. That was really, truly informative. It's very exciting to see, all the changes that we're going to have here in Kamloops, and it's going to be opening, summer 2022, so it's happening. soon. We do have time for questions, and I do see that there's a question about, Todd, if you can, someone's asking a question, well, what would be the net gain of ORs with the new tower, and will this help the current wait list that's happening now in surgery?
Yeah, so that's an excellent question, and it's actually what we are doing as a site right now strategically, is to try and leverage as many new ORs as we can, but also recognizing that we have our existing ORs within the building that we want and need to keep open to allow us to further develop our surgical services and our surgical programs. And so it's a bit of a chess game and moving the pieces around a little bit, or a game of Tetris, because what we've committed to is actually leaving some of our existing ORs open, which actually will allow us to free up more operating rooms in the new tower. And so, for instance, one of the rooms in the new patient care tower was a designated C-section suite. But what we've actually made the decision to do is leave that room open back in the existing tower, such that it frees us up to now have another elective room in the patient care tower. And similarly, we made a decision to take one of the urology theaters out that was scheduled for the patient care tower, and similarly leave that behind in the existing tower. And so we're working through right now exactly what that business plan is around how we fund the additional rooms, recognizing that with the original funding, the original funding for patient care tower, there was one additional elective room that was funded. We recognize, and working with our surgical programs, the demand and the need here, and we are working through that piece right now to really figure out how we can leverage as many new rooms and theaters as we're able to. And so I'm careful to not be able to overcommit to anything, but I'm acutely cognizant of answering on behalf of our surgical programs that we're looking at every opportunity to expand our surgical services.
Okay, someone else has asked, what will happen with the vacated spaces in the hospital?
Yeah, as we work up through the tower, there's a number of spaces that get vacated, but then we come back to those spaces and fill them back in phase 2 of the renovations. So right now, we'll move some on the on the second floor, which is where the emergency is expanding into. As I said, that program area is going to more than double in size. And then from that, emerge will increase in that space. On the third floor, that's the 3 West area, is where our new pediatric ward is going to go. So we are developing a new pediatrics ward that goes into that vacated space. And then on the 4th floor, the vacated space there will become the new recovery area for the operating theaters. And then what's happening on the inpatient units is that we are taking patients that were in those 4-bed rooms and converting a 4-bed room into a 2-bed room, and the 2-bed rooms into single-bed rooms. What this will allow us to do is it's really going to give us a buffer in the hospital to continue to grow and expand, where if we needed to, in a worst case scenario, is we could always flex back up on those rooms. And that's really the challenge that we have right now, is when we're over census, we don't have a lot of extra spaces to put people, and then people end up going into hallways and other places that are obviously not ideal or optimal for patient care from any sense.
Will there be more staff needed in the new tower? And of course, you did touch on it a bit. How will this help recruitment?
Yeah, so I think from the staffing perspective, from a physician's perspective, I think it's going to allow us to continue to grow and develop our programs, which will then allow for more recruitment of surgeons, et cetera. Because I think if, in particular, if you look at our joint replacement program, we have room to grow there. And I think that room to grow would probably mean bringing in an additional surgeon or surgeons, for example. The patient care tower, actually, the formal construction of it actually finishes kind of later on in 2021. But then there's this whole period of commissioning, they call it, where basically we get the tower ready, which includes how staff are going to get redeployed on the nursing units, et cetera, and how the units move over, the new equipment needs, all that kind of stuff. And so there almost certainly is going to be an increased staffing that will be needed. When you're doubling the footprint of the emergency department, it's hard not to imagine that the staffing won't increase there as well. So I think that almost certainly the staffing is going to increase both on the nursing, allied health, the support staff, as well as the medical staff side of things.
Will there be more room for improved cancer care that we've been hearing through the election?
Yeah, so thanks for bringing that up, Heidi. And I did allude to that in the opening, or in the mid part of my presentation, where I talked about the 3 different phases of our master site plan. The first being our clinical services building, the second being our patient care tower, and then the third being the third building being really an expanded area that would probably include a full cancer treatment center as well as other services. So I'll answer the question in a couple of ways. First of all, I think that with the announcement in the election, which was excellent news, if we look at the delivery of cancer care, there's multiple different components of cancer care delivery. There's medical oncology, which is the medical treatment, chemotherapy, et cetera, of our patients. There's our surgical care of cancer patients, which is the operations that they need. And then there's the radiation therapy component. And so what's been promised was certainly that Kamloops needs a full cancer center, with really the intention of bringing radiation therapy to Kamloops sooner than later. And I think the question of how we bring all of that to the site is the question of the hour. I think there's no question that we ultimately want a full service cancer center with all of that housed under one building in one area. And I think that would fit nicely into that third building. You know, having said that, the new patient care tower will certainly enhance a number of areas of our cancer care delivery, and in particular, enhancing our surgical care. We are always looking at ways in which we can come back in within our existing building and enhance the delivery of the medical care. So currently our cancer unit's on the 8th floor of the existing building, and will there be opportunities to expand into any other previously vacated program areas? I think that those are the opportunities that we need to look at. So in the short term, it's definitely going to help us. It is not, there's no way to insert in at this time any further components of radiation therapy in the new tower. The requirements for that would have really jeopardized the tower and all the other components that are so necessary to the site, and the tower finishing on time. But I think we certainly recognize that with our third building of our master site plan, that really would allow us to further enhance and develop cancer care. And there are other components too, lab-based components of it, imaging components with new technologies, PET scanning, CT scanning, nuclear medicine, all those other components that would also be upgraded potentially in that third tower. And so, while we're very happy with the patient care tower and accepting of it and what it's bringing to us, we ultimately still want and need that third tower as well. And that's an exciting opportunity for us.
What will be the total bed count once the tower is finished, tower project?
Our bed count is, the net bed count will actually only increase from a funded perspective by 15 beds, which is going to put us somewhere in, I think they're in around the 280 range, or thereabouts, 285, I think. So, you know, having said that, what you will find is, and as I spoke to, that we will have a lot more bed capacity at the hospital, significantly more than what we currently have now, that will allow us to accommodate those surges. And so again, you know, when I mentioned the third building would as well have inpatient components to that. And so I think it does speak to the need that we can't lose sight of that third building, and that in fact, a lot of the major decision makers are well aware of that, and the need to continue to look and explore what that third building would look like. So it's not unusual for many of these new projects to still retains a lot of their older buildings, and that is where you can still maintain a lot of your clinical programs and to flex up when you need to.
And also, Todd, you spoke about changes also in community and home health. So it means more people will stay out of the hospital and get better help while they're at home. So the less need for people to come into the hospital. Hospitals don't need the same amount of beds as community health grows. You spoke about that to me.
Yeah, so totally, and I think that's a lot of the work that's happening on the community redesign piece. We know that there's lots of pieces around primary care and primary and community care. The primary care piece being access to primary care with primary care clinicians, which has certainly been a problem within Kamloops that everyone is working hard to address. But also, as you alluded to, Heidi, how we can better serve patients that are being looked after in the community. And there's a huge amount of work that's going on to really ramp those services up. And there's the slogan "Better at Home," and it truly is that most people would prefer to have their care at home. There's actually some exciting projects on the go right now, which is called an acute home hospital project, where patients that otherwise would have been admitted to hospital are cared for in the home environment by physicians, by registered nurses. Obviously, there's strict criteria. They need good supports, but a lot of patients would prefer that. And so absolutely, there's always going to be a need for inpatient acute medicine, but I think we also need to look at how we deliver healthcare and take that healthcare back to the community that can be delivered even in a more patient family-centered environment, allowing patients to have access to all of the acute care that they need, just served in a different way. And then again, how we manage our elderly patients with proper elderly services to again support them in the home community, which allows them to stay out of our acute care facilities and reserving those for what we need, and then appropriately using our long-term care facilities as well.
Okay, sorry, one last question, just to talk about the mental health patient numbers on the increase since COVID has, I won't say blessed us with its presence, since we've been dealing with COVID. You can speak about that.
Yeah, it's it's certainly there's no question that COVID's had lots of negative impacts in lots of different areas, and I think in fairness, we knew that our mental health and substance use was on the upswing for quite some time, which speaks to the need to do all of the enhanced services that we've spoken about. And with COVID, I think it definitely is taking its toll on people. So I think that our job is obviously to respond as we need to. Fortunately, a lot of mental health can and should be appropriately dealt with in the community setting, and so it really behooves us to ensure that we've got those appropriate resources there that are going. And I think that there has been a good response from our mental health teams, but no question that COVID has been impactful from a mental health perspective for many people. Fortunately, the end, I think, is in sight. There's definitely, there's no question, there's definitely likely some difficult times over the next couple of months, I would think. And then would probably look as we get into the spring, the vaccine gets more prevalent and more of the population gets it, and we get people back outdoors again. I think that we're going to see the easing off of restrictions and whatnot. That's just sort of my personal take on where we're going to probably go with things. So the end is in sight. We need to do everything we can, though, in the interim to ensure that we maintain the capacity within our healthcare system.
Okay, one really last question. Someone wrote, what excites you the most about the new patient care tower, Todd, from your perspective?
Well, I'll put my clinical hat on first. I work as an emergency physician, and I really want my new emergency department. So that's the selfish part of me answering the question. From my role as the chief of staff, it's really the surgical programs. When I started in this role 3 years ago, actually, 3 years on December the 1st, it's hard to believe it's been that long already. We had a major rebuild that we were doing within our medicine programs. And then as we got the medicine programs rebuilt, it then became our surgical programs as the focus. And we had a bit of a hiccup with an anesthesia shortage that was a global shortage, as well as a BC and an RH shortage, which really hampered our surgical programs even further than where they were at. And then we recovered from that and we were all set to go. And then COVID struck, and I thought that was going to be another hiccup. And in fact, what we've come out of it the other side with our provincial government really continuing to double down and really ask how we can continue to enhance our surgical care and ask us to do more. And I think the timing is perfect for us to move into the patient care tower, where we have these brand new operating theaters. We have the existing capacity on our old theaters. And I think it will really allow us to provide the provision of care from a surgical perspective. And then as I look to the future, it's really cancer care and the growth of cancer care moving forward, which I've spoken about already. And I'm really excited to see where we go with that, and that's on the horizon. And so those are the pieces, I think, for me that have been really the personal rewards.
Great. Thank you, Todd. And you know that the foundation is raising money for all the equipment in the tower, and that includes everything in the surgery suite in the theaters. And so we're very excited because that's where the money's going that we're raising. So thank you, Todd, for answering those questions. And over to you, Jim.
Thank you very much, Heidi. I've said it before and I'll say it again, and I know it embarrasses him quite a bit every time I bring it up, but we're so fortunate to have Dr. Ring as our chief of staff. He is a truly dedicated man. I'm impressed with his leadership, and I know that we're in great hands with Todd's leadership moving forward. You know, it was an early donor who said to us during one of our presentations, who looked at us and said, boy, this is going to be like a brand new hospital. And believe it or not, at the time, I hadn't thought about that. But yeah, because of the domino effect of what will happen in the tower and of course in our current facility, that's true. It's almost going to be like a completely brand new hospital. It also has the domino effect, as Todd mentioned earlier. It perhaps, when you give medical staff, when you give practitioners, doctors, the opportunity to work in a first-class facility, in a very vibrant city, with a great standard of living and an affordable standard of living, boy, those two things can be extremely powerful. And I think that that's another key reason to support the Tower campaign. To our current donors who have joined us online here tonight, we thank you from the bottom of our hearts. It means everything to us. We hope that we'll have an opportunity to get everybody together in 2022 for the ribbon cutting. For those of you who have joined us and are hearing about this for the very first time, or getting the detail on it for the very first time, we hope you consider supporting the Tower campaign. And let me just say this, if you have questions at any time, please do not hesitate to contact the Royal Inland Hospital Foundation staff. Simply ask them the question, and I know they will get back to you as quickly as they can. They also are a very dedicated team of professional people who have done an outstanding job in bringing this project about. We'll be taking it to the community, hopefully in the spring of 2021. And hopefully by then we'll see more of an end to this COVID situation that we're in right now. Again, I thank you very much for joining us here tonight. To all of you, Merry Christmas, Happy Hanukkah, and good night, everyone.